1,503, the total number of Hoosiers who have been known to have COVID-19. We also saw an additional, unfortunately, 31 deaths in our state. To date, 1,295 Hoosiers have died of COVID-19, and another 119 are believed to have died from this disease based on their symptoms, their x-rays, and other diagnostics, but did not have a positive COVID test on record. Both our ICU bed and ventilator availability remains at steady levels, with 42% of our ICU beds and just over 80% of our ventilators available today. Of the ICU beds in use, about 18% are being used for COVID patients, while just under 7% of ventilators are in use, being used by individuals with COVID. Nearly 125,000 Hoosiers have been tested for COVID-19. That's an incredible increase in just this past month. We want to keep that going. That's why we continue to encourage people to visit one of the 20 statewide testing sites we opened yesterday through our partnership with Optum, or one of the 5 drive-through clinics we're hosting this week. All of those sites are listed on the testing map at www.coronavirus.in.gov. If you have symptoms of COVID-19, please come get tested. If you're at high risk because you're 65 or older, you have diabetes, obesity, high blood pressure, or other underlying health conditions, or if you're a member of a minority population that's at greater risk, please come and get tested, even if you don't have symptoms. You can register for the Optum sites at lhi.care/COVID testing or by calling 888-634-1116. At these sites, you will actually leave your vehicle to go inside to be tested. At the drive-through sites, you can just show up and stay in your car, but you may encounter some wait times. Both testing and expanded contact tracing will start Monday, and they're very critical parts of our phased-in approach of reopening Indiana. But today I want to take some time to spend talking about what every Hoosier should be doing right now. There is only one basic reason that we can safely start to talk about how we can reopen during this pandemic, and that's because we, as a state, have changed our behaviors. We've stayed home, especially when you're sick. We're disinfecting surfaces more and more. We're washing our hands. We've avoided large groups, and we have to keep doing that. Think of this like a diet. If you don't make lifelong changes and you go back to overeating and not exercising, the chances are you will regain the weight. To get through this, we have to remain vigilant and remember how COVID-19 spreads. If you cough or sneeze, and sometimes even just with breathing in and out, you're releasing respiratory droplets that can carry the virus. Others can get infected when they breathe in those droplets or touch a surface that has been contaminated, and then they touch their face or their eyes or their mouth. As our state begins to reopen, we start to think about going out to eat, back to work, to church, or even to see your mom on Mother's Day. We need to remember that this is the new normal, not normal, the new normal. We can't forget about social distancing, washing our hands, wearing a mask, or most importantly, staying home if you're sick. I know life is going to look different, but that means it'll also look safer. We're hearing from around the state about new steps that are being taken. Sneeze guards are being put up at the BMV or drive-through windows at restaurants. Companies are looking at ways to place employees in every other cubicle and keeping plenty of hand sanitizer on hand and requiring their staff to wear masks. Businesses are requiring customers to wear masks in their stores. Even airlines are blocking rows to help with social distancing. I want to talk a little bit about masks. I know some people think that wearing masks everywhere you go is overkill, but remember how COVID spreads. If you wear your mask, you are protecting others from your own respiratory droplets. That means they're less likely to get infected if you sneeze or cough or breathe out on them. That being said, there are times when you probably could go without a mask if you're healthy. If you're walking outside in an open space and you're social distancing, or if you're going for your run, you probably don't need to wear your mask. If you're sick, put a mask on to go to the healthcare professional, but don't go out if you're sick. If you're in your private office and no one else is coming in or out, you can probably take your mask off until someone is due to come in. But if you're inside and there are other people present, it's really important for you to keep your mask on. I just want to demonstrate about putting your masks on and how you want to make sure you wear that. This should go over your ears securely or be tied at the top of your head and at your neck, and it has to cover your nose here. I know I have glasses, so my glasses always fog up, so I try to pull mine up, pull the glasses down, or when I was in surgery, I always put tape on my face, which I know can be irritating. A lot of people worry about taking their masks off and how they do that they might contaminate themselves. Remember, those are your germs that you're carrying. But if I take my mask and I lay it down like this on the surface, I may be contaminating that surface. I can't emphasize enough how important it is to wash your hands frequently. When you wash your hands, sing a song. ABCs, happy birthday 3 times through, plenty of soap. Make sure you're doing it for a long enough period of time. Afterwards, wipe your hands with paper towel and keep that paper towel to open the door and drop it hopefully in the wastebasket that's close by the door. I want to take a moment to mention gloves. Gloves are not bad, but unfortunately gloves give people a false sense of security, and sometimes they inappropriately place people at higher risk for spreading their germs. Wearing gloves doesn't really protect you, especially if you've worn those all day and you're up around your face, moving your mask. And remember that whatever you touch on this surface and go to another surface and touch, you're going to actually potentially infect. And so realistically, it's better if you just wash your hands or alcohol your hands frequently. Even healthcare workers wash their hands before they put their gloves on and after they take their gloves off. And another caution, and I know I heard Dr. Weaver say this one day, your cell phone is probably one of the dirtiest things that you carry with you. Put it up to your face and your mouth all the time. Carry little alcohol swabs and just wipe it down. Use earbuds if you have them so you aren't putting it up to your face all the time. If you decide to go back to church instead of worshiping at home, don't crowd in the same pews. Space out. Again, the governor and I prefer that you continue to do telechurch or even church from the parking lot in your own cars with your own families. And no matter how much you want to, don't hug your elderly mom or grandma on Mother's Day. In fact, avoid hugs and kisses and handshakes completely here for a while. I know my husband and I are sad that we won't be able to be with my mother-in-law who's in a long-term care facility, but we respect and understand that we don't want to infect other individuals. And remember, we want to protect our highest risk, most vulnerable population. So if you're elderly, if you have underlying medical complications, especially if you're immunocompromised in some way, please continue to stay home, social distance, and limit your exposure. Thank you very much.
Thank you, Dr. Box, for those updates and very clear reminders. Partner, you've got a lot of updates of your own in your portfolio, ag updates, rural affair updates, housing updates, and tourism. COVID-19 is affecting every agency that we oversee, and you want to give us an update on 4 or 5 of yours.
Certainly. Thank you, Governor, for this opportunity to provide updates on the agencies that I oversee. Let me start with agriculture. Our farmers are no strangers to uncertainty. Whether it's trade negotiations or inclement weather or now COVID-19, we continue to see the resilience in action. And our 94,000 Hoosier farmers are dedicated to providing healthy, safe options for our Hoosiers. You know, at this particular point in time, we know that agriculture is extremely important in Indiana. It contributes over $31 billion to our state's economy. We are the 10th largest farming state. And now is a pivotal time because right now we are in the planting season. The good news, we have 33% of our corn and 22% of our soybeans in the ground, which is way ahead of our 5-year average. And as farmers are on the roadway getting the job done, let's remember to be safe as we drive our roadways, not just for our farmers, but for all Hoosiers. And as I mentioned previously, the Office of Community and Rural Affairs, or OCRA, created the COVID-19 response program to help our rural and small communities all over Indiana. And to date, we have granted $10.7 million to 62 communities to assist in 4 key areas: increasing access to medical facilities, providing testing resources, increasing food pantry services, providing grants or loans to small businesses for job retention. And several communities have already deployed these resources out to their local area, like Hartford City. They're providing personal protective equipment for local first responders to address the spread of COVID-19. The funding will also provide rapid COVID testing for 2 Abbott machines. The city is also supporting the Community Health Service Food Pantry, which has seen a 38% increase in traffic since January of this year. The City of Brazil is purchasing 2 months of groceries and supplies for local residents in need. And by partnering with the Clay County Emergency Food Pantry and the Senior Citizens Food Pantry, the city is able to provide assistance to 4,400 families and individuals. Union County is using the funds to purchase personal protective equipment for its local first responders and to provide COVID-19 testing to its county residents. With 20% of the county aged 65 years and older, it is vital that rapid testing is available. The county is also purchasing equipment to install internet hotspots around the courthouse in the town of Liberty. They currently have no Wi-Fi locations available to the public, and due to the stay-at-home order and schools transitioning to e-learning, Wi-Fi connections are critical, especially in underserved areas. These hotspots will also assist residents who need to file for unemployment or complete job applications. The City of Wabash is another community that several weeks ago received $250,000 to provide grants to their local business community. And I'd like to introduce you to 2 special guests who will share with us their plans on how to use this money. So, Governor, at this time, I'd like to introduce Wabash Mayor Scott Long and Grow Wabash County President, CEO Keith Gillenwater. Are you on?
We're on. On.
Wonderful. Well, Mayor Long, let us start with you. Can you describe the current economic impact of COVID-19 on Wabash?
Well, our local small businesses have done a really good job of adapting to online selling through social media to get them through this time. And the local restaurants have offered curbside takeout and delivery service since the onset of the shutdown. This has allowed them to maintain their businesses somewhat thus far. We initially had 8 factories lay off people, and we look forward to them reopening. That being said, it's been tough for everybody. We are grateful for the opportunity to partner with the state of Indiana and its agencies.
Well, Keith, tell us a little bit about these Okra funds and what they mean to your community. And then if you also could walk us through how you're deploying those funds and the types of Hoosiers who will benefit there.
Sure. Let me start by saying thank you. We're honored to be able to appear as part of the news conference today and tell a little bit about Wabash and Wabash County's story. As the mayor alluded to, our community has gotten hit pretty hard. People have been good in Wabash County about staying home, but one of the unfortunate side effects of staying home and has been that reduced spending in our businesses. You know, a number of the restaurants are trying to do what they can in businesses converting to online sales and those kinds of things, but it just doesn't replace all of that walk-in traffic. So, you know, on top of that, it's been a hardship for our manufacturers as well, with markets and drying up and those kinds of things. And so this Okra program and the partnership with the state of Indiana is very timely for us. It's very important. It'll help our community, our business community, from Main Street to our business and industrial parks. And it's going to help the businesses that need it most, of that employ a large percentage of low to moderate income individuals, which is a requirement for the program. We're planning to deploy the funds to small businesses that qualify. So We're specifically targeting hospitality, food and beverage, small manufacturers, retail tourism-based businesses, and the like. At least 51% of the funds are required to be used to retain jobs of low to moderate income individuals. Our grants that we have set up are ranging from $2,000 to $15,000 based upon the number of employees in that business. We have gotten the flexibility to streamline the process as much as we can to reflect the times that we're in. So the social distancing. So we've been able to convert an online application. Business applicants can submit their documentation online through our website. Our committee will meet virtually via Zoom. I think we're meeting on the 18th of this month. And so from the announcement last week to getting the funds deployed, we're trying to get it out there as quickly as we can. We're very blessed that the city of Wabash has agreed to front the money for the grant until we can get a grant agreement signed and those kinds of things, because we need to get this money out to our businesses. And so, again, I tip my hat to your office and to the Okra and the state for having this partnership available for us. We're very blessed.
And Mayor, is there any final message you can leave us with? Anything additional that you're doing to help your businesses and your residents there in Wabash?
Yeah, I had my city council pass a resolution utilize $100,000 of my economic development fund to be used for low interest loans. And those are being administered by Greater Wabash County for the city of Wabash. Wabash Marketplace has offered their members low interest loans from a revolving loan fund. And our Tourism Bureau Visit Wabash County transitioned their team from tourism driven to assisting the small businesses with marketing help for online sales, one-to-one marketing plan consultation, and assisting with building out budgets and best practices. As a group, we are building ongoing relationships with these businesses well into the future, not only for sustainability currently, but for growth also. One final thought, rural America is the backbone of this nation, and the small towns that dot the countryside like Wabash are going to be the economic engine that brings our economy back to life. It's paramount that small towns across America plan now as Wabash is doing. We need our local businesses to not only survive, but to thrive on the backside of this pandemic. Agriculture is going to play a big role in that also, as they're the backbone of our food chain and very vibrant here locally. That is at a critical juncture right now. How we support the small business and agriculture now will determine our future.
Well, thank you, Mayor, and thank you, Keith, for being with us and sharing with us how the partnership that we have with Wabash is benefiting citizens all over your county and in your city and the state of Indiana. And thank you for your service, Mayor.
Thank you.
But I would also be remiss if I didn't remind everyone once again of the housing assistance that we have available. Our housing agency has a resource guide online to support Hoosier homeowners and renters as they navigate crucial conversation with their lenders and their landlords. And I encourage you to have those conversations right now. But we've also reopened Indiana's Hardest Hit Fund, which provides up to 6 months of monthly mortgage payment assistance to qualified homeowners. Go to 877gethope.org or call 877-GET-HOPE for more information. But another critical part of our economy is tourism, and the travel and leisure-related industry was immediately ground to a halt when COVID-19 hit. Our Office of Tourism Development has started conducting weekly surveys to study the impact of COVID-19 and assess what this truly means for the industry, both now and in the future. Today, we announced the formation of the Indiana Destination Recovery Council. This is an advisory group of industry leaders and experts who will collaborate on the most effective ways to get Indiana tourism back on track. And the first meeting of the council was held virtually today. We started by talking about each of their industry-specific needs and the challenges that they are facing, and how we can effectively work with the Governor's Economic Relief and Recovery Task Force to provide assistance. This group will continue to meet through June and work hand to hand as we work through this together. Governor, you know this week is Visit Indiana Week, and it certainly is going to look a whole lot different this year. And I want our partners to know that the Governor and I are with you and walking alongside you. Travel, adventure, and family fun are some of the memories we most cherish in our lives. And we cannot wait till that day comes when Hoosiers can visit the attractions we have here, and we can welcome visitors back to Indiana. So thank you, Governor, for your leadership during this very challenging time. And through all the uncertainty, one thing remains very clear in my conversations with Hoosiers. We are strong, we are resilient, and we are in this together.
Thank you very much for your leadership on all those multiple fronts, making a difference. Fred, you are up with some updates on the unemployment insurance benefits.
Yes. So we had 43,277 initial claims filed for the week ending May 2nd. This continues to show a downward trend since our peak claims week back in March. We're also seeing a record number of payments being made. We made 1.4 million unemployment insurance payments back in the month of April, for a total dollar amount of $749 million. So far in the month of May, we've made 313,000 unemployment insurance payments, totaling $237 million. So all in all, since April, we've paid out around $986 million in federal and state benefits. That's close to $1 billion in benefits since April. So when we look at our call center, our volume is still high, more than 1.3 million call interactions in the month of April. So far in the month of May, we've had about 153,000. Our wait time is still high, and our callback efficiency is improving. So we're improving on both of those two fronts, but we're still nowhere close to where we want to be, and we're still nowhere close to claimants actually feeling that positive trend. But we're encouraged that that trend will continue. We've seen some recent changes with the additions that we've made to our staff. We've had additional staff to join this week, over about 160 of them. We've seen some changes in the new technology that we've added, which has allowed for more callbacks. We're also experiencing a greater number of workers being able to answer more questions. So our goal is to ensure that these positive trends continue, but more importantly, that people are starting to feel the positive trends. So I want to share a little bit about our federal programs. As you may recall, we had several federal programs that we had to implement. First, we had to implement the Pandemic Unemployment Compensation Program. That was the additional $600 a week program for our regular UI claimants. We launched that last month ahead of schedule. We also announced for our Pandemic Unemployment Assistance Program, this is the temporary unemployment insurance program for those who have limited work history, independent contractors, and those self-employed. We successfully launched the application intake process in April. On last night, we took our uplink system, our unemployment insurance system, offline for a few hours to make some updates so we can go into our final phase of PUA. And that final phase is the actual payment of the benefits. So that went successful last night, and we'll start seeing payment disbursements being made on tomorrow under our PUA program. Not all payments will be made on tomorrow. Those payments will be made in batches. So if you don't see a payment in your account, don't fret, it's on its way. we've had over 75,000 applications to have been successfully filed under our PUA program. I want to talk a little bit more about another federal program that we've had to update our IT system for. It's called the Pandemic Emergency Unemployment Compensation Program, or PEUC. This is another federal program under the CARES Act. This provides 13 weeks of extension payments after a person has exhausted their 26 weeks under the regular unemployment insurance program. Our IT team has worked diligently to put this program in place. The extensions will take place beginning on tomorrow as well for those who are impacted. So we've successfully implemented 3 of the federal programs required under the CARES Act. And we continue to make sure that we're providing services to you, and we want to make sure that we continue to do them better every day. So I want to talk a little bit about job availability and public information. As a reminder, the Department of Workforce Development has a responsibility to ensure that we're connecting people to resources. Those resources include job training, they include connecting individuals to jobs, and also connecting employers to skilled employees. Just this past week, or this current week, we've had 2 virtual job fairs. They've been very successful. On Tuesday, we had one in eastern Indiana with about 4 employers. Yesterday, we had one for the General Motors plant in Kokomo, where they're filling more than 1,000 full-time and part-time positions. There was a very good turnout virtually for both of those. So coming up on May 20th and May 27th, we have a virtual job fair for the Terre Haute area. On May 21st, we have a statewide virtual job fair for the Census Bureau. Right now, I'd like to pause and tell a little bit of story about a gentleman named Nicholas. Nicholas lost his job as a result of the slowdown of his company. Nicholas went to one of our Work One locations to seek employment. Then he wanted to join the armed services to serve our country. Unfortunately, he was unable to join the armed services. While he was talking to the case manager at the Work One, the case manager informed him of the GM Ventec project making ventilators. He applied. The next day he was hired. He's been working and making ventilators for over a few weeks now. He was not able to serve our country through the armed services, but he has been able to serve our country providing this vital resource, the ventilators, over in Kokomo. So I want to say thank you, Nicholas, for serving our country in that way. So I want to spend a little bit of time talking about what we have planned for information on return to work. As you may recall, we've been getting a few questions about return to work and what does that do to my unemployment insurance from both an employer and an employee standpoint. We're going to provide several information sessions for both employees and employers. We have webinars planned for both claimants and employers over the next 2 weeks. Specifically, we have a Facebook Live event scheduled for May 13th for both claimants and employers. We will provide you with information on what you need to know about return to work requirements. We'll also continue to update our frequently asked questions on our website. I also want to remind us that we have a rapid recovery plan and action team in place now. We've been having this team in place for quite some time, and this rapid recovery plan, again, it's an accelerated action plan to support Hoosiers in securing jobs, growing skills, and developing talent when we work our way out of this pandemic. This is a joint effort with the Governor's Workforce Cabinet, partners like Strata and TPM and Associates. So prior to COVID-19, we were engaged with a variety of training programs with over 900 active employers training more than 8,000 people. Our plan is to refocus our training to address this moment that we're in now. Keep in mind that during COVID-19, although we've had hundreds of thousands of claims filed, we're continuing to pay close to $1 billion in payments. We're not making those payments fast enough, but we will get there. and we will ensure that each and every Hoosier who's eligible for benefits receive their benefits. Thank you, Governor.
Thank you, Fred. Rachel, we always try to save the second half of the hour for Q&A, and we went over a little yesterday. So how about if I just thank everyone for doing your part per Dr. Box's reminders. Let's keep moving in the right direction. We're on a good path here. And let's just get right to the Q&A portion right now.
Sarah with WNIN.
Hello, Sarah. Good afternoon.
Good afternoon. The City of Evansville, along with the IU School of Medicine and Deaconess Health System, is doing a COVID-19 prevalence study in southwestern Indiana. What are your thoughts on local communities taking action to test, trace, and study the virus outside of state measures? And a second question would be, when might we see the data from the Fairbanks School of Public Health study?
Both great questions, Sarah. So first of all, the Fairbanks study, we're hoping to see that data and be able to present it to you early next week. So I'm not sure Monday, Tuesday, or Wednesday, but we're looking forward to going through that data with them sometime over the weekend. And we welcome any city or county that does additional testing and additional prevalence studies and continues to keep COVID-19 infection at the top of their list of things to address for their community. It is so important that we have boots on the ground across the state that is they're presenting the same message that we are about wearing masks and social distancing and washing hands and helping their particular community employers get people back to work. That is all very critical. This is not something that can all be done from Indianapolis, Indiana.
And I would just say, I think I can speak for the Lieutenant Governor as well. We're proud of Deaconess. We're proud of our hospital network at large. Not only are they stepping forward in terms of studies, but they stepped forward immediately right out of the gate that allowed us to all come together, to be in this together, and make sure that we were properly resourced from border to border. So this is just an extension of how our hospitals throughout the state of Indiana are stepping up.
Sam Quinn, the Indianapolis Business Journal.
Good afternoon, Sam.
Good afternoon. I have a question just about specifically Marion County. It seems between your roadmap for reopening and then Mayor Hogstead's plan to keep the stay-at-home order in place until May 15th, there's confusion for restaurants and personal services about when they'll be able to reopen. Can you talk about that, when they can expect to reopen?
Sure can. Our executive order and our guidance is a week after you enter that second stage. And so for Marion County, my order was coming up on May 11th, but theirs would be a week back, so May 18th. Now, Mayor Hogsett has the 15th in place to potentially lift. That's up to him. I support him, but the 18th would be for Marion County when restaurants would be able to open.
Emily Ketterer, the Daily Journal.
Good afternoon, Emily.
Good afternoon. So my question is about the Optum testing site. So there were some discrepancies in information yesterday. For example, the Johnson County site was listed as a drive-through location and it was not. And then our local health department was also confused about who could be tested. So my question is, how were these issues addressed and why weren't these sites necessarily prepared for something like this to happen?
So again, it was a first day for 20 sites across the state, and there are always hiccups. I think that our map has a little, maybe a car or a vehicle on it, and I think that was confusing for people. So we're trying to rectify that and make sure that everyone understands. That's why I mentioned in my talking points today that the Optum sites are park and go inside sites versus our drive-through testing sites. And I know that can be confusing for people. So we're trying to make that more clear for individuals. I don't think anything ever opens and is absolutely perfect on the first day. So I really respect that we've got this up and running. I've done over 1,000 tests and I'm looking forward to those tests just continuing to increase. We did change a little bit the individuals that could be tested in that we included asymptomatic individuals who have these risk factors, including our minority populations. And we're very much encouraging people to get tested. So that was different for our drive-through sites sites and something that Optum, when you registered, it wasn't something that you could pick. So that may have caused a little confusion.
You want to talk about, just repeat, we have 20 now, but 30 are coming online as well.
Right. So we have 20 that came up this week, and we will be adding the additional 30 next week. So that will give us our 50 sites. But I think everyone needs to remember that we also have over 100 other sites that are testing, not including our drive-through sites across the state. So it is not just limited to the Optum sites.
Tom Davies, The Associated Press.
Afternoon, Tom.
Hello, Governor. With the Tyson plant in Logansport starting to reopen, the union there says the state needs to commit to action such as enforcing physical distancing, 2 weeks paid quarantine time, and not allowing retaliation for workers who raise safety complaints. Do you believe those are steps the state should take to help those workers feel safe about returning to work?
You want to talk about how we have been up there? Yeah.
Sure. Well, we have been up there and actually looked at the plant and saw the dividers that they'd put in and how they had staggered individuals on the line and social distanced individuals. I am not sure about their policy with regards to paying workers, with regards to sick leave, but I do know that they have instituted pretty much every measure that we ask them to do with regards to this.
Fred, before we move on, Fred, you want to just give an update on what you're looking at out into the future in terms of folks who are COVID-19 positive or have been quarantined, to Tom's point?
Sure. There are a few things that we can look at in our current executive order and even the phases that we're going to go through, or the stages in our recovery plan. When we get a claim and a person is off of work as it relates directly to COVID-19, those things are taken into consideration. And those individuals may very well continue to receive benefits. But if there are things that we can't verify, then, there may be another result. But our goal is to make sure that there's direct interaction between employee and employer. And we're looking at a variety of things like the safety of individuals who are over the age of 65, to make sure that we are being compliant with what the governor has set out in each one of those stages of our recovery plan and also the CDC guidance.
Yeah, and no matter, Tom, how large the number gets or how specific the location, each of these cases are decided on a case-by-case basis.
Steve with KPC Media.
Good afternoon, Steve.
Good afternoon. How are you doing today?
Doing good. How about yourself?
Good. Two questions. First, for Commissioner Payne, if I'm counting it correctly, next week would really probably be the first week we'd see some impact from the stage 2 reopening. So is there any way that the DWD is going to be able to quantify the number of people who are getting back to work and going off unemployment? And then my other question is, yesterday there was some talk about getting some county level hospitalization data, and it sounded like that was something that the state would be able to do. So I wanted to kind of backtrack to something that was in the forefront a couple weeks ago and talk about nursing home data. I know there'd been some resistance to individualized facilities and the number of cases, but could we maybe take a step back and get county level data, at least for nursing homes, and if not, why?
We take the first one. Okay. Yes, we will be able to do some analysis on the data on who's on unemployment now, and then even those who go back to work. The question that will remain is, were those people who are returning to work, are all of those COVID-19 related cases? Because not everyone who's on our unemployment insurance benefits program now, not all of them are on that as a result of COVID-19. So we'll do some analysis, and that'll take some time.
Thanks, Fred.
And with regards to your questions about the county level data for hospitalizations, I should have mentioned yesterday that if you go to our website, there's a link to Regenstrief's website, and you go there, you can see a lot more information that is available to you to look at from a county level perspective. I do have the team actually working on doing regional level data with regards to the ventilators and also ICU beds. And with regards to the nursing home data, we will continue to release aggregate data for nursing homes.
Kayla Sullivan, Fox 59.
Afternoon, Kayla.
Good afternoon, Governor. We've been informed new nursing home guidelines no longer require nursing homes to disclose the number of COVID-19 deaths at a facility, just the number of cases. If that is true, why did the state stop requiring the disclosure of death numbers? And then my second question, do you encourage businesses to disclose the number of COVID-19 infected employees to staff? Why or why not?
Dan Rosiniak, Chief Medical Officer for FSSA. I can answer the first question. So CMS came out with its guidance previous Friday on what they would be requiring. We have not changed our frequency. We're still requiring daily reporting. We did change that they didn't have to report daily number of deaths, but we still require long-term care facilities to provide the total number of deaths that have occurred in their facility. What we've tried to do is to make sure that our requirements, although we have a greater frequency than CMS, that we're matching what they're asking long-term care facilities to report.
Yeah, and Kayla, I'll just say, correct me if I'm wrong, Dr. Box, from a medical perspective or privacy issues, but Kayla, the second question that you had, that would be up to the individual businesses, and then most importantly to that individual that has tested positive.
Right, and we do think it's important that an individual that's positive would share that information with their boss or their employer, because there are obviously maybe individuals that are around them that would be at risk. So that is important to share, and if they didn't want to share it, we would need to share that with the employer.
Elizabeth Binion, WNIT Public Television.
Hello, Elizabeth.
Hello, Governor, and thanks again for these daily updates, and thanks to your whole team for all of your tireless efforts to help the people of Indiana during these difficult times. Yesterday, the Senate Democrats held a media briefing and reported that the United Steelworkers and Senate Democrats have contacted you to express concerns about CDC guideline violations and unsafe working conditions in some Indiana businesses. Well, your media briefing yesterday focused on businesses that are eager to protect their workers. Senate Democrats and some labor leaders have expressed frustration that IOSHA seems unwilling or unable to enforce safety guidelines or penalize businesses that break the rules. What is your administration doing to ensure worker safety, and will your administration consider forming a task force with labor representation to focus exclusively on worker safety issues?
Yeah, Elizabeth, we have a process. Joe, you want to give folks a current look at where we are? It's Thursday, I guess, but I mean, IOSHA would be looking at this in the old times and in the new normal that we find ourselves in right now. So we are absolutely focused on worker safety, and any tip that we get is investigated.
Yes, Joe Herons, General Counsel here in the Governor's Office. So in the executive order, we do talk about, and this goes back in the last few executive orders, that the recognition that IOSHA has and businesses have a general duty clause, which they need to provide a safe working environment. And so that is Indiana law. That is something they're supposed to be providing. To the extent there are complaints in that regard, they go to IOSHA, and IOSHA has the ability to look into those. And so that is the process that exists now, and that is something that is in place and should be addressing concerns that arise that people have with business practices.
Thank you.
Brandon Smith, Indiana Public Broadcasting.
Good afternoon, Brandon.
Afternoon, Governor. My question is, I actually have two questions, hopefully relatively quickly. First, for Commissioner Payne, does Indiana have plans, or will it need to ask the federal government for a loan to supplement the UI Trust Fund? And if so, what will the interest look on that loan? And then a question for maybe you, Governor, or one of your staff. Sure. There's been some confusion expressed to me from multiple bar owners about the differentiation you make in the guidelines between bars and bars that serve food. Bars that serve food are allowed to open at 50% capacity under phase 2, whereas bars and nightclubs have to wait a couple of phases in order to reopen. So quickly, what is the differentiation between those two? And could a bar reopen soon if they just start giving out Hot Pockets?
There's always someone. Well, I think the difference between, Fred, why don't you let Joe step up here first, and he can clean up what I say here. But I mean, I think Brandon, other than you need an ID to get into a bar and you need to be 21, and that's not the case for a restaurant. But the thinking that we had going into this, our bars are typically areas where you're sitting very close to each other, maybe on stools, standing closely. And again, just like other sectors, other lines of work, we couldn't do everything all at once. And so we're phasing this in, and that's the real distinguished point about this discussion. And I understand, and I've had the same question, Brandon, asked of me, but you want to talk about just from a technical perspective?
Sure. So the executive order that went into effect for stage 2 on Monday, and that obviously restaurants can begin operating in the near future. It talks about a couple of things, and I'll just run through them, and then I'll make some comments in general. But it makes very clear that in restaurants that have bar areas, so think about a restaurant that has a bar section, that bar section has to be closed. Okay, so in legitimate restaurants that have a bar section, that bar section is closed. In a separate paragraph, it categorizes bars and taverns, and that those need to remain closed. They've been closed to this point, but they need to remain closed at this point. There's also language that you cannot have live music or disc jockeys, for example. Those are not permitted, and again, it's because we don't want this to be a social event with a lot of people close together. But think about it this way. Restaurants that have a bar area, that have a legitimate food service and a dining section, those can be open. Bars and taverns that might provide popcorn or Hot Pockets, really that don't have a legitimate restaurant feature to it, we have to apply common sense to this, right? And if you do that, we all know what those kind of bars and taverns are like, and they need to remain closed at this time. And so that's what I would add to it. There is some guidance that I believe is been put together, FAQs through the Alcohol and Tobacco Commission on this point to try to clear up some of these questions. And so I would direct people to look there to provide some guidance to them on how to move forward based on these different types of operations.
Thanks. You remember the first question, Fred? Yeah.
So with regard to our unemployment insurance trust fund, we are a little bit south of $600 million, and we're monitoring that very closely on almost a daily basis. So as we monitor it, we'll know if and when we need to tap the federal government for a loan. In terms of what the interest rate will be, we'll have to follow up with you on what that interest rate will be if we have to do that.
Yeah, and Brandon, and I like your second question. You were asking for a friend. I duly noted about the bars, but we're also tracking the conversation that's going on in Washington, D.C. with our congressional delegation, and as that unfolds, we'll also be making our voice heard out there as well in terms of what the fine print looks like.
Rob Burgess, the Wabash Plain dealer.
Hello, Rob. Good afternoon.
Good afternoon, Governor. Dr. Box, my regards to you and your family. Thank you for that practical advice at the start. I think that was important. Good to see you again, Keith, Mayor Long. It's been too long since I've seen you in person. I guess this is for Keith or maybe Lieutenant Governor Crouch. Are the PPP loans getting out to small businesses you're working with? I know there was a recent injection of more funds federally after the first amount was quickly exhausted. And I guess the second question is for Governor or Dr. Box. I wanted to return to privacy and contact tracing. Obviously, that's worked well in places like South Korea, but how do you balance privacy concerns with public health when it comes to that?
We have already, as you heard from the mayor and from Keith, their city council has gone ahead and fronted the money so that they can get the money distributed in lieu of us getting the grant paperwork signed so that we can get the money to the city. So I am assuming that is going out immediately to be able to provide that PPE to those first responders. If the mayor or Keith is on and that's not correct, please jump in.
Yeah, I'm happy to. We've had a lot of success with a lot of our small business community as well as with our nonprofit community at successfully applying for and receiving the PPP loans through the SBA and through a lot of our local community lenders. So we've been very happy with the amount that have been awarded.
And I'll kick it over to Dr. Box and OBGYN and Rob. He has joined your force. Yeah, he was delivering a baby. And I think you talked about this privacy issue maybe last week a little bit in terms of tracing. You want to elaborate again?
So congratulations, by the way, Rob, and good job.
Thank you.
What I want to say about privacy, the Indiana State Department of Health is very, very used to protecting privacy as we do contact tracing. I mean, we deal with and have dealt with diseases like HIV and syphilis and a lot of other diseases for many, many years, and that is always at the utmost of every decision that we make. That being said, there are diseases that we have to contact trace. We have to notify people that they've been exposed to a particular disease, and sharing that with people like employers or other individuals is critical so that we can help to prevent the spread of that disease. So we are very, very careful about that. Individuals that work with us and help to do the contact tracing are basically under an obligation to share absolutely no information, and they will be seeing and talking to enough individuals that just typically doesn't happen. But I can tell you, having been a physician all these years, that we're very, very careful. We always have been careful, and we will continue to be careful with that privacy.
No Social Security number shared?
No. If someone asks you for a Social Security number, it is not the Indiana State Department of Health calling you for contact tracing. I can tell you that.
Eric Berman, WIBC.
Good afternoon, Eric.
Afternoon, Governor, and Dr. Box, my condolences on your loss. Governor, I wanted to revisit a question from 2 days ago. You said as we head into stage 3, you're going to be looking at the same metrics that got us into stage 2, hospitalization, capacity, testing, contact tracing. My question is, what do we need to see? Is it just, do we need to see those go down further, rather hospitalization go down further, testing go up further? Do we need to just maintain where we are? Do we need to avoid increases beyond a certain point? What are you going to be looking for to advance to the next level?
Well, at the minimum, we need to be prepared for any surge that may come on the horizon. We need to make sure that we continue to flatten this curve and draw it out. We don't know how long this will be with us, but I'm guessing through the end of the year and maybe beyond that. And so the 4 principles will be timeless, quite frankly, Eric. They will, as long as we can care for those who are in need, as long as Hoosiers are practicing good physical distancing and good hygiene, and our elderly population is staying at home more so than cautiously going out and re-engaging, the folks who have those underlying health concerns, as Dr. Box ticks off every day, then we're on the right path, and we will go from stage 2 to stage 3, depending on what this virus does. It's a novel virus, so it's we're learning so much about it on a daily basis around the world. But yeah, we'll continue to look at those 4 principles. They are what's gotten us to this point, and we'll experience more progress if we continue to pay attention to them and have the resources, those beds available, the ventilators available, the PPE available. But it also comes down to that behavior. You want to?
So we expect that the cases will go up when we start to open things up. Again, that's why we're protecting our most vulnerable population, so that hopefully we don't experience those severe morbidity or mortality associated with the cases. But I think at the same time, what we'd like to see is, as those cases are going up and we test more and more people, I'd like to see that percentage of positives of the number that we're testing start to go down. And we may see that in certain regions of the state before we see that in other regions of the state. So that'll be entering into our decision making.
And next week we're going to learn, I would guess, again, not a physician, but the Fairbanks study. This will be important because of the very nature of what we're studying.
Julie McClure, The Republic, Columbus.
Good afternoon, Julie. Thanks for joining us.
Hi, Governor. Thanks for taking my question. Bartholomew County is home to a large number of manufacturing facilities employing thousands of workers in southeastern Indiana. I'd just like to get your view on whether you believe these manufacturers have enough PPE to safely reopen, and what guidelines are you giving manufacturers beyond OSHA regulations for reopening?
Well, we've not only listened to those manufacturers, we're the #1 manufacturing state in the country per capita, and we aim to keep it that way. not just going into this COVID-19 environment, but coming out of it as well. And some of the global companies there in Bartholomew County, manufacturing companies, are leading on the effort in terms of safety, always have, and they'll continue to, no matter what hand they're dealt. And so not only have we incorporated their suggestions about physical distancing, about hygiene, about shifts, I mean, it's a long list of how to do business in a safe manner with this virus on your doorstep or on your factory floor or in your lab or in your schoolhouse. So all of these issues have to be taken into account on how we're living our lives today. Obviously, manufacturers in the state of Indiana, critically important, not just to our revenue, but to the ability to continue to fund all the efforts, whether it has to do with FSSA or the Department of Health. Virtually everything that we're doing is reliant on our state to continue to grow. We had a lot of advantages going into this. We still maintain those advantages because of the innovation that happens at, say, Cummins in Columbus, Indiana, or actually it's a Cummins corridor all the way up to Indianapolis now. But we maintain a good tax and regulatory environment. We maintain a good Hoosier workforce and work ethic. And we maintain having, as Fred has mentioned just earlier today, workforce development programs, training and retraining our workforce. And so all these things factor into that question about where we'll be in terms of what the future looks like. But absolutely, safety considerations are front and center right now, as they should be.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be tomorrow at
With 4 locally owned shops, North, South, Franklin, and Fountain Square, we have online, in-store, curbside, and delivery options.